Vital signs are one of the first skills learned in our PT education, yet they are one of the most underutilized skills in our toolbox. This educational session is to explore the critical need for PTs in the era of direct access to play a part in continual screening of our patients' health markers.
Why is taking vital signs important? Technology, direct access, and patient perception. Taking vital signs is important because there are changes in the role of PT in healthcare. Although technology has allowed the healthcare system to become more connected and complex, there are still significant gaps in patient care. One study reported that the adults they surveyed received recommended preventative, acute, or chronic care services, which included vital sign screening, among other measures, only 55% of the time. All 50 states currently allow some form of direct access to physical therapy services, with 18 states allowing unrestricted direct access. As part of the evolution of physical therapists' role in healthcare system, basic medical screenings should be included as part of a routine physical therapy practice. Patients' positive impressions of a physical therapist's practical skills and training have been shown to increase patient outcomes and satisfaction with their care.
For the purpose of this educational module, vital signs are considered heart rate, blood pressure, and oxygen saturation. By monitoring vital signs, we can obtain a patient's baseline, measure their exercise response, and screen for various lifestyle-related diseases. Obtaining a patient's baseline. We cannot monitor changes or speculate on the diagnostic value of vital signs changes if we do not know a patient's baseline measures. This is the basis for all clinical decision-making regarding vital signs for the rest of the patient's episode of care. For example, if a patient appears to be in distress, but their vital signs appear in a normal range, there is no diagnostic value to the measurement, without a baseline to compare to. Knowing a patient's response to exercise. Did you know the American Heart Association recommends terminating an exercise if a patient's systolic blood pressure drops more than 10 millimeters of mercury? Physical therapy practice includes exercise prescription and monitoring our patients to make sure that they are safe. Part of this is ensuring that they have an appropriate response to exercise. Although we can visually monitor their response, there are many medications and other factors that may create an abnormal vital signs response that would be missed if the PT was not monitoring vital signs. Screening for disease. Hypertension is a major contributor to cardiovascular disease, which is currently the leading cause of death in the United States. 1 out of every 3 adults has hypertension. Out of the large population that has hypertension, it is estimated that 60% are unaware that they have it. Most people with hypertension have insurance and are seen by healthcare providers twice per year, yet remain undiagnosed. Of those who are aware that they have hypertension, half do not have it well controlled, even with medications. Considering all of these research statistics, some of your patients have undiagnosed and thus uncontrolled hypertension. One study where physical therapists volunteered to measure vital signs in all patients found that more than 75% of their patients with no prior cardiopulmonary diagnoses were found to have abnormal blood pressure readings. Lifestyle diseases, including cardiovascular disease, are predicted to rise in the next 20 years. This already large issue is about to get worse, making screening especially important for all healthcare providers. Current evidence on the use of vital signs in outpatient PT, where we often have the least amount of medical information about our patients. Although the APTA recommends monitoring vital signs as a part of routine physical therapy practice, most outpatient PTs do not measure vital signs. Almost all therapists believe monitoring vital signs to be important, surveyed at greater than 89%. Very few respondents in a study by Peters and a follow-up study by Harrison reported that they routinely measured vital signs during evaluations and follow-up treatments, fewer than 13% and 30% respectively. Only 11.2% of outpatient therapists reported that they regularly measure vital signs.
Most physical therapists determine need for vital sign measurement based on visual inspection of the patient, even though visual assessment is a poor measure of general health. In a study by Feldman, a panel of 4 PTs, 1 student, 1 new grad, 1 orthopedic specialist, and 1 cardiovascular specialist were presented with different patients and asked if they would measure vital signs based on their visual assessment of the patient. None were able to correctly assess the hypertensive status of the patient based on visual inspection alone. When asked if they would monitor vital signs of these patients during treatment, the student and cardiovascular specialist reported that they would monitor vital signs at every treatment session. The orthopedic specialist and new grad reported that they would measure vital signs 12% and 36% of patients respectively. 68% of the patients were hypertensive and would not have received optimal care in this scenario.
Some of the most commonly reported reasons for neglecting vital signs measurement in the literature include physical therapists not feeling that they are important for their treatment populations, physical therapists reporting that vital signs are monitored by other healthcare professionals, and physical therapists worrying that they do not have enough time to perform vital signs measurement. Most respondents in a study conducted by Peters reported that the reason they do not measure vitals is because it is not important for their treatment population. The problem here is that, as stated before, visual inspection is unreliable, and 1 out of every 3 adults in the United States has hypertension. Despite the belief that vital signs are not important to your treatment population, there is a statistically significant chance that it is important for every population. In a study conducted by FGCU DPT, where PTs volunteered to measure vital signs for each patient at each patient encounter, they found that over half of their patients with no previous diagnosis of hypertension were in fact hypertensive, and over 65% of patients with a prior cardiopulmonary diagnosis did not have their blood pressure well controlled. 28% of all outpatient encounters demonstrated blood pressure in stage 2 hypertensive range, and 1% were in hypertensive crisis. In another study examining the reasons why PTs neglected vital signs measurement, 23.3% of respondents indicated that they did not measure vital signs because their patients' vitals were monitored by other healthcare professionals. However, we already know that more than half of patients with hypertension do not have it controlled, which would warrant another visit to their healthcare provider. We are now primary care providers, and with the continued growth of direct access, patients may not see a primary care individual. You may be their only access to healthcare. Other reasons cited by PTs in this study included lack of time. However, despite many PTs citing lack of time for measuring vital signs as a reason for forgoing vitals, one study found that the majorities of PTs polled estimated that measuring vital signs would only take them 1 to 3 minutes.
Conclusion. Lifestyle-related diseases, including heart disease and hypertension, are projected to increase rapidly over the next 20 years, creating an increased need for screening and monitoring of these conditions. Vital signs are quick and easy to measure and can give us a wealth of information that we can use to improve the care of our patients. Most outpatient therapists do not measure vital signs as part of their routine patient care, which can lead to missed opportunities to monitor a patient's health in response to exercise. As direct access expands, physical therapists are increasingly becoming primary care providers and should strive to include basic health screenings as part of their patient care. Physical therapists are ideally placed in the current healthcare system to be able to monitor our patients' vital signs at every visit. As we have seen, this can have a massive positive impact on patients' wellness and guided interventions for lifestyle diseases. We can also play a role in elevating our patients' perception of the physical therapy profession and improving their trust in us as skilled professionals that we are trained to be.